you've heard of heart transplants, cornea transplants, eyelash transplants, though? Yeah, that's probably a new one. Check out these photos. What started out as a procedure for burn victims is now the latest cosmetic procedure. We'll talk to a doctor who's making it happen. That's next. All right, at Prime News, we're going to lighten things up for you a little bit now. We, of course, never advocate wandering eyes, but if you want to, shall we say, enhance your eyelids, well, it turns out you could get lash transplants. I kid you not, this is an actual procedure. Long, luscious lashes can be yours if you don't have them already, thanks to plastic surgery. Is it a lasting trend, though, or one that if you blink, you'll miss it? That's next. Well, you definitely have not seen it all when it comes to cosmetic surgery. The new must-have, eyelash transplants. Check out these before and after photos. The technique is called, get this, plug and sew. Dr. Bauman performed the surgeries in the photos. He is the founder and medical director of Bauman Medical Group, which is a hair restoration practice in Boca Raton, Florida. He joins us tonight from Davie, Florida. Doctor, good to have you with us. First, give us an idea. How does this plug and sew procedure work on your eyelid?
Well, it's actually pluck and sew, and eyelash transplantation is a natural extension of the types of techniques, the hair restoration techniques that we use to restore scalp hair. And now we're doing single follicle implants directly into the lid. And
this actually started out for folks like burn victims, people who needed it for medical procedures. Give us an idea, how many people are getting the treatment?
Well, the demand has been increasing incredibly. I mean, I personally have had 100 inquiries in the past 4 months for eyelash transplantation. And it's booming now. I mean, things are rolling. It's unbelievable.
Of those 100 inquiries in the past few months, are they mainly for medical necessity, or is it more for cosmetic reasons?
Well, Erica, initially when we started doing these procedures about 5 to 7 years ago, it was exclusively for trauma patients. But what's happened is that the word has really gotten out now, maybe through the internet and word of mouth, that this technology can really enhance the lashes. And so we've got people now coming in with sparse, thin, weak lashes, and we're able to enhance the length and the density.
Some people might look at this, though, and say, all right, I know this is your business, but when you're looking at this as a cosmetic procedure, it kind of takes vanity to a new level. I mean, what does this say about Americans?
Well, I disagree, Erica. I mean, enhancing one's eyes has been a form of beauty and an expression of attractiveness since the dawn of recorded history. I mean, there are biblical instances of women using makeup to enhance their eyes. Of course, mascara has been around for over 100 years in its present form. And certainly, fake eyelashes were used in the 20s, many Hollywood starlets. So this is just a natural extension of, hey, the technology is here, let's use it.
It's not cheap, though, we should point out. It's, what, $3,000 an eye?
Oh, that's correct. I mean, this is a delicate surgical procedure, Erica.
So what's the recovery like? Are there any risks here?
Well, anytime you go under the knife, there are always risks. Thankfully, bleeding and infection are very low. The recovery is going to be a few days. You're going to have some bruising and some swelling, and then the lashes just kick in and grow.
And they grow on their own, so you actually have to, it's my understanding that you have to trim them?
That's right.
So how often do you trim them? I mean, because you don't trim your eyelashes normally, so.
No, normally your eyelashes would grow for about 100 days, and then they would flake off. But since we're using scalp follicles, which have a growth cycle of years, the lashes need to be trimmed routinely. So maybe every few weeks, you're going to need to trim them.
It is just wild to see, and they're so long in that picture, they might need to be trimmed on this woman.
Right. Well, I think you're looking at, I don't know if you're looking at the picture that we just implanted those lashes on that patient on Monday. So those are fresh, and they are a little bit long when they first go in.
And then eventually they will be trimmed down. What's next for you?
What's next? Wow, well, we've just got to deal with all of these women who want longer, thicker, more beautiful lashes. I mean, lashes are the window dressing for the eyes of the soul.
Well, it'll be interesting to see what's next. I have to admit, though, Doctor, I think I'm going to stick with my mascara for now.
Okay.
Dr. Bauman, thanks for your time tonight.
You're welcome.